Hey friends, welcome back to Inlera University. My name is Jasmine Veles, and I'm so excited that you have made your way here to our channel. In this space, we are committed to alleviating the stress and confusion in the business of healthcare. Today, we are talking about the ways that you can streamline your patient flow and hopefully improve your patient retention, which means they keep coming back and they stay with your practice through the front desk. So there is a way for our front office receptionists to have a hand in improving our patient experiences overall. And let's talk about that today, bringing on someone that is an expert in the field. I'd like to welcome back to Inlera University, Miss Phylicia Belfast. Hi, Felicia.
Hi, Jasmine. It's good to see you again.
Thanks for being here.
Thank you for having me.
So I wanted to chat with you about how people can improve the patient flow, but let's talk about why they should be listening to this from you. What is your experience in healthcare to date?
Okay, I'd be happy to tell you. And I think it's also important to kind of tell you where I am right now before I tell you where I started from. Right now, I'm currently managing two primary care practices. I have obtained recently my bachelor's in science and healthcare management, specifically in a concentration and specialization for leadership. And the reason why I particularly want to keep rising as a leader is because I want to create a foundation of healthcare professionals, whether that's from front desk to clinicians, lab providers, all delivering high quality care to our patients. And I started actually many, many years ago in high school, volunteering for a hospital. I was doing basic filing of charts before I had my first job at 16 as a front desk for a clinic. And then I eventually moved my way up to scheduling, to referrals, and now here I am as a manager.
I love this. It's so fantastic to hear from people who break into healthcare by way of volunteering or just kind of testing the waters a little bit, right? Getting your feet wet, just getting out there and being introduced to what it's like to be in the healthcare field, to just get a sense whether it's something that you want to do. So I just commend you for taking that journey in, and I recommend it all the time. So it's always wonderful to hear that it actually works. And so Felicia, what would you say is the way that a front office receptionist can help support our patient experience and potentially smooth out that patient flow and help retain the patients for the medical practices?
I will be happy to answer that question. For those who don't know, I think it's also important to understand why it's important to obtain feedback from our patients, not just for the practice or for yourself, but this is opportunities for growth. This is for growth for team members to excel in the field. This is growth for the organization to continue popping up more different offices so we can help people on a greater scale. So, communicating with our patients is essential for understanding what we're doing great and what we may not be doing great, and things we kind of need to excel on because we don't know everything. We have things already kind of in place that we think we need, or in regards to resources to help take care of our patients effectively. But there are times that things are missing. There are moments that we need to basically have. What's the best way of calling it? A inside look on what we may be doing from a different perspective. So therefore, I think as front desk team members being our front line, they are the face of the organization. They're the first people that patients see when they walk in the door, just like they're the last patients when people leave our office. So it's important to communicate with the team and our patients to say, hey, how did your visit go today? What went well? What didn't go well? That way we can take that information back so we can promote better opportunities or room for advancement.
Hmm. That's great. So we're saying that we want to make sure we're obtaining feedback from our patients. And we think that the front office reception role is a great place to have these conversations and hold the patients accountable for providing that feedback. Is that what you're saying?
Absolutely what I'm saying. I mean, while they're waiting to check in anyways.
Exactly. Let's have a
it's
conversation. Let us
building
know how
those
we're doing.
relations. Yeah, building those relationships is always important. I mean, and it kind of flows back when it gets to the clinical team to the providers because it's the very first step that patients make when they walk in the door. They see you, the front desk person, and if you're in a sour mood or if there's something going on or something that you're unsure of and that shows, that kind of leaves a bad impression for the rest of the visit. So it's
Oh yeah.
important to kind of hit the ground running. the very beginning of the start and make sure we are obtaining that communication and relationship with the patient before we transfer that care to the clinical team member or provider next.
I love that. Yes, really getting them off onto the right foot and letting their experience start up on a high note instead of a low note.
Exactly.
And it really does have a way of impacting the patient outcomes on the back end, right? Not just the receptivity, like they may be less receptive to trusting, to believing in, to even hearing what the clinical team is saying if they started out with this wall up because they were treated poorly, right, by the front end. So I think all of that is such great advice and information, like to be considering when we're trying to find out ways to leverage most effectively the front end, right? Because a lot of the medical practices start off with this basics, like, oh, just do the phones and do these, various tasks that are great and necessary, right? Insurance verifications and routing patients and all that. But what are the things that are going to help us hone in on whether or not we are doing a great job? Whether or not our patients are really being served in the way that they desire for their own care, and also is what we're doing translating, right? Is it actually having that impact? That's the bottom line, right? So I love it.
I do
So
agree.
yeah, so tell me, is there anything else that you want to add to that, Felicia?
I would say that it's important to what the most professional way I can say this is be mindful of your character and your demeanor. I understand as just human beings, things always happen in our personal lives, and sometimes they may not be easy to actually come to work and be able to give 100% focus on your duties. My best advice and suggestion would be it's easier said than done to leave anything happening at the door before you walk in, but if you can, bring those discrepancies, those concerns to your manager or any other leader that you may have on site so that way we can kind of work through it together. And the reason why I say that it's important is because people don't realize that expressions, emotions, feelings can actually show within our demeanor, our behavior, our body language. And sometimes that can be misinterpreted the wrong way. And just speaking from example, I'll give you all an example within my team now at my front desk. She was actually having a personal issue that happened to her, and she explained it to me, but she was just upset. Her body was just not facing the patient. She would turn her back to them. And it wasn't purposely done. She's generally a nice person. It was just a bad day, but that translates wrong to the patients perceiving that information. So always kind of be mindful of what's going on with you. You don't necessarily have to tell details to your leadership of what's happening, but it is important to communicate if there are things happening because we don't want to stress our team members out, just like we want to make sure that we are coming across appropriately and professionally to our patients as well.
Mm. That's so powerful. We've had deep conversations around this very recently in our reception series that we've been having on our live stream. So if you guys are interested in that, I absolutely recommend you revisit those videos. But yes, such tremendous nuggets, like beautiful nuggets in what you just shared, and so important that, we take inventory and accountability for ourselves and what's going on in our personal lives. And truth is sometimes it's easy for us to put that over there and leave it. Sometimes it's not so easy, right? Like if you have something that you're being faced with, a big challenge, something mental health, something health related, maybe someone very close to you in your family, it's important to share that you might be having a little bit of a difficulty with how you're showing up so that everyone is aware. And it's not saying that it's as an excuse to not do your job, but instead it's just a consideration that you can be super honest about. Listen, I'm going to do my very best, but this is what I'm faced with. Because if there's grace that can be provided to you by your leadership team, maybe there's a way that they can modify your role, have another person there as a secondary support for you, that it's possible, right? So I love that you even mentioned that, because there's so many people who, they don't know that it impacts everything. Downstream
I
impacts.
totally agree, and I thought it was important to definitely mention that to anyone who's interested because I've been in that I guess element or scenario before. So and there's always hesitations, right? Hesitation of can I even talk to my manager about this? Should I mention it or should I kind of just keep going about my day? I promise you, it's worth mentioning. It's worth being honest. We're not asking for anything else as someone who's actually in a leadership role. I don't need to know the details. I just need to know if something's happening. And I need to know if there's anything I can do, if I can help. And if not, then we need to work through it together. but I don't want to burden you, just like I don't want to affect patient care as well.
Oh, so real, so real. And 100%, these are things that are so somewhat nuanced. Like they're not as apparent when we think about, oh, patient flow. Well, obviously just, move this chair over there and this table here and this piece of paper. Like we think about all the physical elements of patient flow or patient experience, like that aren't necessarily related to the real outcome that the patient, which comes by way of feeling. Do they feel supported? Do they feel cared for? Right. And these are the things that can impact that outcome, right? So I love this. Such great nuggets in this. So thank you so much for being here, Felicia. You guys, Felicia Belfast here. If you want to get in touch with her, I'm going to have her quickly share how you can do that way.
Absolutely. I am currently on LinkedIn, my friends. So please look me up, Felicia Belfast. My name is there, spelled correctly. I typed it myself. So if you ever have a question, you ever have an uncertainty, you're ever going through a situation that you feel maybe I just need a little bit clarification on before you pull that trigger and kind of make your final decision, I'm more than happy to help.
I love that. That is what we were all about here in this space, is getting you guys connected to the people, the resources that will help you along on your journey. So excited to have you here, Felicia. Thank you so much for drawing in your expertise for us here in Inlera.
Very much pleasure to be back on the show. Yes, Jasmine. Thank you so much.
Listen, friends, in this space, this is exactly what we do. We have these conversations that are going to support you. We also have resources for you and courses available. So if you are someone who is brand new to our community, you're going to want to find the links down here in our description box and get connected to us on all the places and spaces you'd like to hang out here on the internet. And also check out our courses, because we have courses that will support you breaking into the field of healthcare, helping you get developed, and so much more. So if you are looking at our content for the first time and liking it, consider subscribing and give this video a thumbs up, and let us know what we can do for you in your journey by popping a comment and letting us know where you need support. Thank you all, friends, and I will see you in the next video. Take care.